right. So my first question here would be, since 2014, all UC campuses have implemented the non-smoking policy. But to this day, smoking on campus is still very common sight. How do you think the school administration, specifically UC Berkeley, can better enforce the policy? What kind of initiatives, investments should they make to address this issue?
Interesting that you asked that question, because a student of mine and I just wrote a paper actually about different UC policies and how they've been implemented. UP has one general policy, as you probably know, but the campuses have discretion about how they enforce them. So there's not a lot of research on like what's better at the college level, but what we know doesn't work is to have a policy like to have a smoke-free campus and then not have any enforcement or implementation. And what's happened at different UC campuses, some of them have invested money in doing things like providing free cessation. They have a website that's regularly updated with classes that are running every month. And then in other states, one of the things that's been done is to create like a non-punitive enforcement method. So if you see someone smoking on campus, somebody comes up and intervenes, but instead of issuing a fine, they'll say, you can take this cessation information for free at the campus, and this will help you quit smoking. And so the punitive methods, like where you give somebody, say, a $150 fine, are also effective. I mean, anytime you make it expensive to smoke, it's going to be less of it. I would suggest, I think, probably some kind of enforcement, maybe starting with the less punitive and, seeing how it works.
For sure.
If it worked very well, then maybe you'd want to move up to something that was a little more aggressive.
Okay.
But my recollection is that UC Berkeley does not have separate funding for tobacco control to implement its policy. And it's not regularly updating cessation classes if it's offering them explicitly, whereas you can look at the other UC campuses. Some of them are much more aggressive about how they're rolling out the policy.
Okay, definitely. We'll definitely look into that. So relating to that, so many teens act as social smokers. They smoke, as we have seen, due to peer pressure or to obtain social acceptance. How do you think we could change this impression of smoking being cool and then decrease the effects of social pressure towards the decision-making process of students?
Yeah, that's a good question. There's a lot of research on what makes kids initiate smoking, and it comes down to a couple of things. First is cost, which is not something I think youth can do on their own, right? That's a legislative decision about how much you're going to tax tobacco. The other is what they call denormalization. And so the state of California historically had a very aggressive anti-tobacco program where they advertised reasons that you shouldn't smoke. And the most effective one for youth has always been, the tobacco company doesn't care about you. They're fooling you. They want your money. And there's lots of research to say that, in fact, that's true. The tobacco industry does think that, youth are suckers. And that's not a message anyone wants to hear. So counter advertising is very effective. It's hard to do, I think, for individuals. But one of the things you can do on the campus level is signage. Actually, it was remarkably effective when they tested it in different universities, just the no smoking area. And then some of the other research that's been done is just providing an alternative that's anti-tobacco based. So in San Francisco, there's a youth organization of teens who've advocated successfully through the mayor's office and the city government to limit tobacco licenses in low-income neighborhoods. They have a website of their own. It's actually really cool what they're doing, and it's become like a social outlet for low-income youth who would otherwise be vulnerable to tobacco industry advertising.
For sure. Wait, do you know what they're called?
Ooh, I should have looked that up before I called you.
All right, I'll look into it. It's okay.
They have, what is it? SF Kids versus Big Two. No, there's yeah, I can send it to you. We can look it up later.
For sure.
Report, I think last year or the year before, that they had written themselves. They did like a lot of walking through neighborhoods to convenience stores, which stores were selling Lucy's. Which was part of, and they did actually change city policy about what are tobacco-dense retailer areas and limiting new tobacco licenses issued in those areas.
For sure. So do you believe, relating to that, do you believe that there should be regulations enforcing cigarette and e-cigarette companies to implement educational and prevention programs towards teens?
No, not at all. Whenever tobacco companies and e-cigarette companies do it, they make sure to do a terrible job. So there are a lot of initiatives that have been in the past. One of the most famous ones is WeCard. That was the tobacco industry's argument that they were doing youth smoking prevention. And the research on WeCard showed that organizations that went through the WeCard training were more likely to sell cigarettes to young people than the ones.
Wow.
Yeah. So what I think should happen is essentially what's happening in California. You tax the product, and then you have independent oversight and creation of youth smoking prevention policies.
Okay. Definitely makes sense. So while it's illegal to market tobacco-containing products towards minors, Juul, among other e-cigarette vendors, are under the investigation for alleged youth marketing. So how do you think students can be more aware of the influence of the marketing strategies on their thoughts and make better judgments for this process?
Yeah, that's a hard one because it's asking individuals to make a push against an environment that encourages them to smoke in lots of ways. Really difficult in a lot of situations. It's difficult in the U.S. for people to fight against what we call an obesogenic environment, which encourages people to eat too much. And it's hard to convince youth to fight back individually against an environment that encourages them in many ways to use e-cigarettes. So the one message that I think is most effective is it's not rebellious to buy a product that's sold to 1 billion people in the world. A mass marketed transnational corporate product. And thinking about how it is that that messaging is meaningful, it's really just a matter of the industry pouring money into it. Because if you sat back and thought about it logically, it doesn't make any sense that you're rebelling by essentially giving the tobacco industry a bunch of money for the rest of it.
For sure. I mean, related to the question about the San Francisco kids and then the low-income neighborhoods, what role do you think Berkeley students should play in the policymaking process to prevent an increasingly younger demographic from using e-cigarettes?
Yeah, well, this is actually a great opportunity because almost all tobacco regulation is happening at the local level. So going to public meetings like local government meetings and just being there to testify when Berkeley considers things like a tobacco flavors ban. Talking to legislators. When I teach health policy, I make all 120 of my students go out and meet one of their representatives, town halls or other meetings. And it's been very surprising for my students to realize just how eager local government representatives are to talk to them and hear what they have to say.
Okay.
Follow through. So I would encourage anybody at Berkeley who's interested in this issue to just get out and get involved in local government. You are guaranteed the right by California state law to attend any government meeting, and they have to listen to you. There's a required public comment period.
All right, for sure. I'll definitely look into that for my organization as well.